Assalamu alaikum, the communication day. You are the registrar in the neurology clinic. Mrs. Sarah, 38 years. She's not responding to interferon as a case of multiple sclerosis, referred by GP to you. She planned to start Fingolimod, and she read about it in the internet. Your task is to sit with Mrs. Sarah and discuss suitability for the new drug and answer the concerns. Are you ready?
Yes.
Okay. Yes, here you go.
Hello, I'm Dr. Abdullah Al-Malla, one of the doctors in the nerve clinic. Am I speaking with Mrs. Sarah? And you are 35 years old.
Yes, I am.
I hope you are not waiting too long for me, Mrs. Sarah.
No, thank you.
Okay,
Credential.
fine.
Okay.
I'm here to discuss with you about your health medical condition and management plans, if this is okay with you.
Yes, okay.
Can we start to be on the same page? Like, what is your knowledge um, about your medical condition?
Yes, I have a disease called muscle sclerosis.
Okay.
Since 5 years, follow with nerve clinic and give
Okay.
me many medication, but this this period not effective and deteriorated every time, some relapsing and
Okay.
feeling sick.
Okay. I'm sorry to hear that. And so and how do you feel at home? How are you doing at home?
Completely dependent on my family.
Okay.
I can't do anything alone.
And are you getting care at home?
No, only help from my sister and my mother.
Okay. Okay. So actually, so I'm here to discuss with you based on our decisions as a team. And so as you know, we are here in the same specialty. So we deal with too many multiple sclerosis cases. And we are here, that's why we are here to discuss like together about a new medication, another medication than the interferon which you were receiving. So despite the interferon and despite, as you said, 5 years of treatment, and despite all this, and you are getting too many new symptoms and worsening, and this make much affliction and like suffering. I'm sorry to say that. Despite that, there is still some hope if we can change to a new line of medication. Because in multiple sclerosis, there are too many options. So I'm here actually to discuss with you. I think you would be much aware. And there is a medication we are planning to start, which is called Fingolimod. Yeah. Did you hear about it?
Yes, reading some note in internet, not none about it.
Okay. So Fingolimod, based on our medical team in this department, we see that as one of the options that could be suitable for you, and it may help actually in your case. Actually, because you are also in the young age, and there is a possibility. I want to ask you about your plans of family, and if you would like to start a family, that would be one of the options that can be also safe. How does that sound to you? I want to hear your opinion.
Yes. Yes, planning to become pregnant soon, but I'm suffering more. I'm really scared. I want to live normal condition like other people.
Okay, fair enough. I'm sorry to say, our hope now is not, it's difficult to be as normal without multiple sclerosis. I'm sorry to say that. As you know, multiple sclerosis is one of the conditions that may deteriorate on the future term, still despite the medication, but hopefully with this with this change in the plan, we may affect little bit the disease progression. We can't promise, we can't be very sure, but we are trying our best. We will keep you in our close eyes and observation in this clinic. And also, we will support you with a whole team of support of occupational therapists and physiotherapists. We keep giving you whole support at home even. And we will give you medications to help reduce if there's any stiffness or like difficulty in mobilization. We will do our best, and we are here together. I'm here, that's why, to listen to you. Do you have any concern?
Yes, I have concern. This
Yeah.
this is safe and not have no any dangerous side effects. Or
Yeah.
means bad effects.
Yeah, very good question. Any medication or anything we give in the hospital, actually, I'm sorry to say, has a positive and negative effects. Now, I'm not a, so we will keep doing blood tests. We will keep observing on your uh, after it has some side effects actually, and I need to discuss with my consultant. I'm not fully aware at this moment, but I'm sorry, I'm not able to help you with this point at the moment.
Okay.
2 minutes left.
Yeah. Any other question?
Yes. My this disease is curable.
It's not curable, I'm sorry, and it's as a so it's not curable, and it may progress, but that's why we are working as a team. We can hopefully manage the symptoms to some degree. That's why we are trying to manage with the whole team support, but it's not curable, I'm sorry.
Okay.
Okay. Any other question? Any other question, Mrs.
No.
Sarah?
No.
Okay.
Yes, I have one
So,
other one. This fingolimod, if take it can get near normal life.
No, I don't think it's unlikely to be a near normal life. I'm sorry to say that. We will keep a close eye on you, and you may there is no 100% chance of that this could be successful, and we have still other plans if this is not working. If still not working, and you developed more worsening despite the Fingolimod. There are too many choices in multiple sclerosis, and that's why we'll keep eye on you. Is that all right?
Okay, time is up.
Mrs. Sada is not answering at all. Okay.
It's okay, well done in general. Let's hear the comment from Dr. Samah.
Okay.
صراحة
She is
والله لكن
depressed.
في ما سأل منها
A
يعني
lot of things, I know.
a lot of things أيوة. ما أولا من الأول كده المقدمة يعني ممكن نقول فيها شوية ديفكت لكن ما حاجة أساسية. الأساسي كان
Dr.
ما
Samah, in
كلمتها يعني
English,
أنت
in English, please, Dr. Samah, please. We have good. Okay,
I miss
please.
every time.
No
Okay.
problem.
You miss many things and most important things. Not tell me about bad effect and good effect of medicine because you came to me and your task to insist about new medicine. How tell me about new medicine and not tell me about the benefits and bad effects. This main point. And other things after ask me about pregnancy or plan for pregnancy or marriage. Not tell me after that if should need to start family, should pregnancy will be planned because this medicine affect pregnancy. Plan with woman doctor and nurse doctor also. في other question other comment about social. يعني not think all point about social. Financial support, you are yeah, support anyone or anyone support you. يعني details of social. And also driving because MS sometimes affect televisions and cause weakness like this. This is most important thing. Nothing more. خلي دكتور باسم يتكلم.
Yes. Okay, thank you, Dr. Samah, for the case and the comment. I agree for the social. I can advise Dr. Abdullah, whenever you hear 2 minutes left, you can leave it for the concern, as you did. But if she doesn't have concern or question, you can start your role to ask about the social, the smoking, the driving, even the job. You don't know her job, right? It was good time to ask about her job. And initially, in the start, you ask her about the support, which was good. I like the way when you start asking, how do you feel? How do you do at home? Who's helping you? Anyone can support you. It was good idea to start to ask about it. Yes, you might do it in order not to forget it at the end. But the job is still, you missed the job. Okay? Yeah, in general, let's talk about any medication. I'm always saying how to counsel about new medication. You have 4 points, at least you have to discuss in the session. Okay? What are they? The frequency, the route, and the duration, and the side effects, as we know. Route, frequency, duration, and the side effect. This is the most important points. So I will ask you this question now in order not to miss it again. What do you think about the route of this medication?
I'm not
Fingolimod.
familiar. That's the problem. I was surprised.
Yeah, we just shared it yesterday. It's one of the oral medication, drug, disease modifying agent for multiple sclerosis. Fingolimod, one of the oral.
Okay.
Okay. Then the frequency, if you know, you can say, but if you don't, you can skip it, because also you might be not familiar with this medicine because it's new for us and new for you.
Mm,
Let's skip the frequency. However, I guess it's once daily. Let's see if someone has details about the frequency, you can share it. I guess also we shared it yesterday, but I cannot remember the frequency exactly. Let's go to the next. The duration. What do you think for the duration? Is it for short time or lifelong?
It,
Dr. Abdullah.
I was thinking maybe for a time and then to reassess.
Yeah,
Uh,
so but it will be for long term, right? It will not be for short term. Or
mm,
if the patient tolerate, it will be for long time. But if
okay.
any side effect happen, it might be for short time. Okay, let's go to the commonest side effect for Fingolimod,
Mm,
and for which we are admitting the patient for the first dose. If you remember it, you will not forget it again. The bradycardia, AV block.
mm,
That's why we are admitting the patient initially. But if everything okay, as you said, close eyes and observation. If it pass smooth without complication, the patient might kept on this medication lifelong. I know a lot of patients they are on this medicine and they are happy with it because it's oral one and it control the relapse. And as you
okay.
said, it's not curable disease. Just our aim is to control the relapse, to make it less progressive and less frequent. Okay.
Should we say halter because of this risk or no need?
Yes. No, no, no,
Okay.
no need for halter. Only admission to monitor the ECG. No need for halter.
Mm, mm. Great, thank you.
Okay. Yeah, this is the point. Again, the social at the end, then the driving and the smoking and alcohol.
And maybe the mood like I should assist on further like everything. Yeah. Smoking alcohol.
But you won't ask about the mood. You can say
Okay.
yes, like instruction. But if you ask about the mood, it will be like question taking, and it will be as taking history. This is
Oh,
against the communication, right?
okay.
You can say, I hope your mood is okay. She will tell you, no, doctor, I feel depressed or low mood because of this disease, and I am here to talk with you, and so on. The good thing when she asks you something you didn't know, you refer it to the consultant. It's safe for all of us. Whenever you don't have 100% knowledge about this question, don't invent. Don't say, yeah, I know everything is okay, or everything will be okay, or you will have side effects which you don't know, and it will be against you in the clinical judgment. So the best way is, as you said, I can involve our consultant. I don't have clear idea right now, and I can refer you to my senior or my consultant to update you about this point specifically, because this is one of the concern. By this way, you answer the concern safe, and you didn't give wrong information. Okay, and also you address the concern, because this point will be with the concern, better than skipping it or missing it. So to refer here, better than saying something is wrong, it will be against you. And not to answer it, it will be against you in the concern. So either you will be minus in the concern if you didn't answer this concern, or you will be minus in the clinical judgment when you give her wrong information. So the diplomatic answer and safe answer to say, I will refer you to my consultant, or I will arrange another meeting. It's smart answer if you say like, I can arrange another meeting to give you more details about the unwanted effect of this medication. By this way, you answer all the concern related to the side effect. because she might give you another question. Doctor, what about my pregnancy? As she asked, and
Mhm.
you don't know what to do. So the best way is to refer her to a woman doctor, and she will be sitting with you and to arrange a safe
Okay.
pregnancy.
Okay.
Yeah, it's like a game. She will play first, then you will reply to her.
Okay.
Yes, really. And uh, if you have time, the patient or the surrogate is not talking, you have to
Oh.
initiate the question of the social. Okay. But
Okay.
in general, you did well and great because you didn't give wrong information, which you don't know. Again, the point you have to talk about in any medication frequency, duration, and the route and the side effect. This is the most important point you have to address in the station. Don't leave the meeting without touching all these things.
Okay.
For example, for the warfarin, apixaban, or whatever. So let's talk about apixaban
Okay.
for a new oral anticoagulant. What do you think?
So it's given by mouth,
Yes,
and it
exactly.
can be it should be taken regularly.
Yes,
Very importantly, it's easy to take if you put alarm of the morning and night. Should be morning.
yes. So it's BID or Q 12 hours, twice a
Yeah.
day. Yes, okay.
Mhm.
This is the route and the frequency. The
Yeah.
duration,
Even according to the in atrial fibrillation, you said, right? It's
uh-huh.
life
Yes, exactly. And the
of
side effect,
it can lead to bruising under the skin
uh-huh.
and of bleeding. You should come to the hospital if you develop any bleeding in the
Exactly.
or in the big bleeding in the nose or
Exactly.
bleeding in the back passage
Okay.
or yeah,
So if you have
avoid
these
injury.
warning things, what you should do?
Oh, like you should hold windows and come to the hospital.
Exactly.
Uh,
So there is safety netting for any side effect you have to give her.
mm,
Whenever you feel it will be threatening her life,
mm.
so you should give her this instruction and safety netting. What you will tell her, as you said, hold it and hello,
Hold it on. Yeah.
yeah,
Uh,
hold it and yes, you said it, but just repeat it again. Hold it and
you mean come to the hospital?
yes,
Medical advice,
exactly.
yeah. Um,
By the way, it will be for the welfare if you say this
mm,
sentence.
mm, 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 mm,
Because if the patient hold it and didn't come and he has profuse bleeding, he might also die because of this bleeding if he's living alone, for example. So you
mm.
have to give future plan. Always give care and follow up for the patient.
Okay.
Yeah, to be showing the examiner that you are caring about him in the future. It's not prescribing the medication and just leaving him take this
Mm,
medication and don't come back. No, it's a matter of follow up and care. And yeah, it's a show.
sure.
I am showing the examiner that I am caring for my patient the future.
Mm,
You can give him contact number of the emergency or whatever the department he belong to.
mm.
Okay. Yes,
Yes.
this is the scenario. Well done, Dr. Abdullah. Anyone has other please you can share. Any question,
في
Dr.
حاجة
Abdullah?
most
Oh, no.
important
Okay.
كمل اتكلم. ده أضيف إضافة بس خليه يكمل.
Oh, no, thank you. I don't have a question. Thank you so much.
Okay, write the scenario please down, Dr. Abdullah, until we finish the comments.
Okay.
Yes,
Okay.
Dr. Samah, please.
عنده there is a lot of side effects for fingolimod, but most
Mm-hmm.
serious event يعني will seek medical advice if occur change of color eye color vision يعني same symptom of MS itself cause change color of eye or eye pain sensitivity to light دي most important severe dizziness وslow of heartbeat يعني most common scenario came by bradycardia
Yes.
أو slowness of heartbeat.
Mm-hmm.
uh, uh, he caused general symptoms, the loose motion, the gastric
Yes.
pain, and diarrhea مش diarrhea
GI
headache.
upset.
بيعمل
Uh-huh.
migrainous headache, severe headache.
Okay.
This most important thing. A lot of
Mm-hmm.
minimal side effect, but this most important to
Mm-hmm.
table. الاي
Yeah.
ساين والهيديك المايجرين والديزينس هو fainting attack. واهم
Yes.
حاجه في الفيميل الهير لوس، بيعمل هير لوس، فلو عرفت انه بيعمل هير لوس should refuse to take it.
Mm-hmm.
Mhm.
Okay. Yes,
ونبدأ.
you're right. Yeah, I agree with these side effects. You should at least know the most common one. And as Dr. Samah said, you can say the general side effect like feeling unwell. This feeling unwell or GI upset with any medication, you can say it with any medication, even augmenting antibiotics or some analgesic. You can say feeling unwell or GI upset. These things happen with any medication. So you can say it as general side effects. If you feel unwell, please don't hesitate to ask or to come to us or to call us. This is one point, and I want also to add one more point for starting any medication. You have to give or to take verbal consent, even by simple question. What do you think about this medication now? Are you agree to take the medication, or how does sound for you? Is that okay to start this? Yeah, you know how to counsel about that
Great.
and how to get consent. Yes, by just verbally. No need to mention verbal. Oh, sorry, to mention written consent. Okay, you can say
Great.
only verbally. Yes, if you can start, just give us a hint or give us opinion. And the good thing also, you are always asking the patient, you have any concern or any question? What's your opinion about that? Yeah, it's a conversation way. Okay, thank you, Dr. Samah. Any question, Dr. Abdullah or Dr. Samah, for this scenario?
Thank you.
I have only one comment.
Yeah, sure. We are here to hear that.
Okay, just when she answered, she asked him how is why my life will be and it can affect how it affect my life.
Mhm.
The answer was no. Yes, it will affect, and you. And when she said, "I live normal life," no, he said no. Always in communication, we should be diplomatic because we don't know the type of here, the multiple
The multiple
sclerosis.
sclerosis,
Yes,
yes.
so just he will answer in diplomatic way. I'm sorry to tell you, it is will affect your life, but it's different from one to one,
Mhm.
and it is early to say how it will affect you at much point or at which point.
Yes,
Because some patients, yes, near normal life, they having
exactly.
only one episode without, and the relapsing limiting, there is one just leave the patient with minimal changes or even no changes in his movement or in his no disabilities yet. And this is one of the disease type have disabilities, yes, and progressive and difficult to control. So if this disease like that, like I will answer in diplomatic way, not sharp answer. No, you will not live normal life like others. Okay.
Yes, good point. Yeah. So to make vague answer because it's not clear the patient will be cured or controlled or even he might
Yes,
relapse
good.
with
It
the
will.
medication.
He will
Yes,
clarify that it is disease affecting the life, but
yes,
to deliver a message that she will be disabled or to be miserable, I think not. It is not real, or it can be not the honest way to deliver this concern.
Yes.
yes. I review now the medication. It's once daily. I will share it again here also. It's oral and once daily.
Okay.
Dr. Bassam,
Thank you,
can I
Dr.
have-
Aisha, for your comments. Yeah, sure, Dr. Azhar.
The
Yes,
examiner
please.
in the examiner in MS case, he can ask, what about my kids? I have MS, and what about my kids? So the candidate has to answer like this. Although this is not inherited disease, but there are chances that you
Yes,
can develop this disease more than the general population.
exactly. Yes. This is the way how
Then
to answer.
yes, and then as a doctora, he already has explained. Examiner may ask, "Will I be disabled in future?" So then he can diplomatically answer that I'm sorry for that. There are chances, but this disease varies from person to person. But there are more
Exactly.
chances that you will be disabled in future. Next, the examiner can ask, can I drive right now? Right now, or I have to stop? So it all depends on if you have no problem with your walking or legs, you can drive. But if you develop any problem with your eyes or with your legs, then you have to stop the driving. Examiner may ask
Yeah.
this question.
Yes, you're right. Yes, you're right. Okay, another way also to answer this issue, I mean the driving. What do you think, Dr. Abdullah, better answer for that? As Dr. Azhar said, yes, it's one of the advice you can say, but also you can have another answer. What do you think?
I can say a general sentence like
Uh-huh.
usually in multiple sclerosis because it affects commonly the eye. If your vision is fine, then you are if your vision is affected, then it should be assessed by the DVLA.
Excellent. Yes, this is the point. So just refer her or him to the DVLA, and they have the rule and regulation about driving with this disease.
They have doctors to assess there. Yeah.
Yes, yes. So they have categories, and they know that the diseases which affecting the vision. So either to tell her don't drive right now, or meanwhile, or to refer her to the DVLA, and they can give her the clear advice about driving, when to resume, when to stop, and what to do. Okay, Dr. Azhar.
Yes, yes.
Yeah,
The scenario
what's
here
your
explaining the fingolimod only in the scenario.
yes, Fingolimod, yes, Fingolimod only. But you have to touch the
Mhm.
driving for the
Mhm.
welfare.
Okay.
Okay. Thank you, Dr. Azhar. I was asking you about the DVLA information and notification, I mean. So, in addition to your answer, either this or this. You got my point. So you can do that or that.
Yes, you are right. You are right.
Okay. Okay. Thank you. So, this is the picture in the chat box. You can see the injectable medication. Let's review it quickly. Injectable under subcutaneous, I mean. Interferon beta, glutamate acetate, interferon beta also, glutamate acetate, and medication picniterform, interferon beta again. Okay, the oral medication, tilferomide, fingolimod, and dimethyl fumarate. This is the oral. The fingolimod here is the dosage is once per day. The IV infusion medication, alimtuzumab. This is all biological, I guess, from the name. Methoxyrenate, methoxyntron, and orilizumab, natalizumab, which we already know about. And the dose is once every 4 weeks. If you see the oral is frequency, I mean the frequency is daily, but for the IV, almost Q month or Q long period. But the oral should be on daily basis. The same for the injectable medication, subcutaneous, also every other day or sometimes 3 a week, every other day, interferon every other day. That's why the oral medication always having advantage of being easily to take and easily to manage at home, not like the subcutaneous one, and without any pain. Easy route and easy way to remember, and so on. Okay, this any other question or comment before moving to the next scenario? No question. Okay, I read the scenario.
I have a
Yes.
small. What other the medications that may bring the exam?
For the MS or for other diseases?
I know multiple in methotrexate, in rheumatoid,
Yes, exactly.
aspirin, anticoagulant,
Steroids.
steroid. Okay.
And recently they brought hepatitis B and, or sorry, hepatitis C. Yeah, I guess hepatitis
Oh.
C and interferon, I think, in
Oh.
Egypt. Last diet, yes.
Mm.
Again, don't be panic. Just be diplomatic in all answers. Try
Okay.
not to give clear answer if you don't know it. And if you have just a general advice, instruction about
Okay.
even the side
They
effect,
bring
you can
also
say any
steroid and infliximab. Steroid and infliximab
yes,
and
inflix.
anticoagulant.
Yeah, steroid and monoclonal or biological. Yes, direct oral anticoagulant, one of them, and warfarin as well. Okay, Dr. Abdullah, don't be panic. Just give a general instruction. And for the side effect, I told you, if you don't remember the specific side effect, you can say general side effect, feeling unwell, GI upset. This happened with the specific. If you don't remember, you can refer to the clinical pharmacist. You can say there is a lot of teams can be helping in your disease management, including the clinical pharmacist. I can arrange a meeting with my consultant and the pharmacist to give you a clear idea about the possible side effects to be cautious about. If you said this answer, you would be safe and getting the mark. But if you have the information, it will be much better.
Great.
Okay?
Yes.
Don't forget the interaction between medication, especially the warfarin and the other medication, warfarin and the diet. This will be more good to mention it, I mean. Okay?
Yeah.
Any other question before moving to the next scenario? Okay. The scenario is, Dr. Samah, you are the gastroenterology senior house officer at the OBD. Mr. John, 35 years, complain of dysphagia and weight loss after upper endoscopy, shows esophageal candidiasis. The consultant has asked you to sit and speak with Mr. John. Good scenario. I guess this is new. Dr. Samah, if you're ready, let me know.
What you say, Dr. Basim? Sami. What you say?
If you're ready,
You said new. Who's new?
let me know. And please make your, if you are ready, let me know.
Yes, I'm
The
ready.
new
I'm ready
scenario.
already.
Yes, this is for us, I mean.
Wait you to finish.
Ready? Okay,
finish
please.
discussion.
Yeah.
Okay. We start now? Dr. Abdullah, ready?
Yeah, let's
I
start.
will readjust the timer, then you can start.
Hello, my name is Dr. Hassan. I'm a senior house officer in the gut clinic. I'm talking to Mr. John, 35 years old.
Yes. Hello, doctor.
We are here today to discuss some issue regarding your health condition. It is okay with you?
Okay. Doctor, please
During
reassure me what was found in my camera test. I'm concerned.
Okay, I'm coming in the scenario. During our conversation, if you want to ask me any question, don't hesitate to stop me. Is it okay with you?
Yeah.
Before we start, I need to ask you how many you know about your health condition.
Oh, yeah, I just know a little bit. Like I was suffering from weight loss and problem with my swallowing, and it was getting worse, and that's why the camera test, thanks God, it has been done to me, and they found, I don't know, like I'm concerned. Is there something very serious, doctor?
Okay. Thank you for sharing this information with me. I want to ask you, you done camera test for your food pipe? You have any idea or expectation?
No, I don't have any idea about it.
Okay. I'm really appreciate your feeling. Now I will tell you, um, I, um I have the result now. Do you have any? I have your result now, but I'm really sorry to tell you, not as we hope.
Oh, what do you mean, doctor?
I tell you, the result not as we hope. Shows there is bug infection in your food pipe. This called esophageal candidiasis. This medical term don't bother by it.
Mm.
This mean bug infection caused by organism called fungal affect your food pipe. This affect the patient with low immunity, means low defect have low immune defect in the defense mechanism, and occur in some situation. Patient with high blood sugar, patient with immunodeficiency virus means uh, uh, immunodeficiency virus. This virus affect patient with low immunity and defect in defense system. But not make sure 100% till do further test. But till we'll finish this investigation and blood test, will I want to ask you some social question. I want to inform you about this.
Okay.
Do you have any partner?
Yes, I am married, doctor.
You married? I want to
Mm.
inform you. Will keep safe sex and or avoid sexual at this period, because
Why?
if you have this infection may transmit it to your partner,
Oh,
because there is, yes. Uh,
what
do you
infection, doctor?
this infection immunodeficiency virus? This means viral affect patient with problem in this problem or issue in defective system, defective mechanism, defensive mechanism in your body. This attacks the virus,
Okay.
attacks the
Okay.
organism, attacks the bug. If the
Mm.
patient affected by this organism became low defense mechanism and get any infection easily, not get by normal people.
Oh, doctor,
Like
you mean the serious HIV? No,
yes,
no, no. I
serious,
don't have that, doctor. No, no.
serious
I
but
don't think so.
controllable. It is serious condition. Due to this, should avoid sex. I'll tell you before in this period. And don't share any needle or any special particle, special article with anyone. and don't
Doctor,
share
I
needles
don't think
and or
I
sharp
don't think
objects. What you say?
I don't think I have this virus, doctor.
I will ask you more questions to get. You have any extramarital relationship?
Well, yes, maybe I had
Maybe.
some visit in
Yes.
travel.
Okay. Do you have sharing needles
No,
or
no,
doing tattooing or piercing?
no, no.
Do you, there is any history of blood transfusion?
No.
Okay. I'm really appreciate your feeling, and I, I will help as we can. Also, I want to ask you, did you smoker?
No, maybe 5 cigarettes since 5 years.
I will advise you to stop smoking, and if you need, because harm to your health condition, and if you need, I will refer you to the smoker cessation clinic to stop it. You don't mind.
Okay.
And
I will think about it. Thank you.
okay. And also, if there is any chance of your wife become pregnant, maybe this back infection transfer to your baby. Due to this, make safe sex till finish all investigation.
Oh, doctor, I'm afraid that I
Don't
will
say
be labeled as bad person.
no. I'm really appreciate your concern and your feeling. But I will tell you, this became confidential, and this results give you manual, not transfer
Mm.
through website or no, give you manual to make
Um,
confidentiality. But will inform you to tell your wife if the result positive. Um, she had the right to know this. If not,
okay.
tell her I will break confidentiality with you because this legal issue.
Oh,
Okay.
okay. Hopefully that's not
So
positive, doctor. Will the
I hope
okay.
not positive, but this infection, not rare, and you have a risk factor. You get said have casual sex
Mm.
out
Mm.
marital state. Maybe, but we hope uh, became negative. Do you have any concern on
2 minutes
any
left.
question to ask me?
Um, doctor, how this test will be done?
Collected blood from a collected sample from blood canal, and we test under laboratory specialist.
Mm. Okay. What if I don't want this test? Like, I'm afraid.
You are afraid from test or from the results to
From
become
the
positive?
result. Like I don't like. I'm hesitant about it.
Make sure, as said before, will become confidential and no one known about this. But for your life, and to to avoid the dangerous complication and serious
Mm.
complication, okay, should done
Mm.
this investigation to take treatment to control the disease, because if not
Okay.
control, lead um, to AIDS. This medical condition not better by this. This mean complete deficiency in the
Mm.
defensive mechanism, and
Okay.
get more infection to chest, to bowel, or
Okay.
gut organ,
Okay.
and other infection to
Doctor,
your
I have
body,
another.
even
Uh,
your brain.
what about?
What you say?
I'm having difficulty with swallowing. Can can you help me with that?
Yes, yes. This help by antiviral or antibug, which you take it for the
Mm.
essential. It to the antiviral which
Okay.
attacks the bug which affects your body, and after treat this will improve the swallowing problem.
Okay. Time is up.
Okay, time is up. Yes, please. Dr. Abdullah, can you comment first?
So you
Then
did
I
well.
see.
Yeah, you did. You covered the station well. Just the beginning needs some, and the middle. Uh, in the end was better than the middle and the start. So the start, you need to open the door of the HIV quickly, because so he is not concerned. It's not like breaking bad news. He's not. Candidiasis is not a bad news much. Like it's not cancer, but um, the bad news here is HIV. So you will prepare him. So how to prepare? Not immediately. Like you did it like in a direct way, and there's some confrontation. I felt confrontation. So so what so in the beginning you will tell, okay, I'm sorry to tell you, you have this fungus which is like a bad bug in the food pipe, spreading to your food pipe, and this is not a typical area that this bug can reach to. It's not an easy thing to reach there unless there's something wrong. What do you mean? I mean, the either your body's defense system is very weak. As you said this, but here when it comes to the HIV, you will say, okay, uh, I'm speaking about, I'm sorry, there is something very serious we need to discuss is if there is some concern about a low in body's defense system, then I need to ask you more questions, if that's all right. First, so you will not ask him like, do you have such? You'll say, uh, let me ask you some questions first about there is some things I need to ask and know. If there do you know if there are some risk factors of something which can lead to your medical condition I'm afraid of, such as blood transfusion, if you had, or unsafe sexual intimate relationships, or you like as you are speaking from a journal, like not asking him, and then he will say, and then you will you will mention all the risk factors and like um, needle sharing, unsafe relationships, um, and uh, ex- exposure to blood products and needles. Are you familiar with any of these, or have you had any of these? I'm sorry to ask. And then oh yes, I remember I had some, and like that. And then you will go to the HIV, and then you will need to consent. So there is important. You mentioned the positive and negative. The I draw your attention, but you should say it and to convince him. Like there is risk if you don't do this test. I will you to avoid the complication. And you will take the consent. I will explain to you. You did explain. I will explain to you. The test is a blood test, but it's very useful, and you will be handled hand by hand, and it's very confidential. And all this conversation is confidential, strictly. Please don't be afraid about that. We will not. Um, we will not disclose your information. Yeah, like that. This test is very important. And then if that test is positive, you will, oh yeah, he needs, you said the safety, he will need a safe relation, he will need to inform his wife, and also he will need to avoid any blood transfusion, a blood donation. Um, yeah, like that. It's just that issue of the indirect way of risk factors. I think that's the point. Thank you. You did well.
Yes, thank you, Dr. Abdullah, for the case. Well done, Dr. Samah, as first time, as you write in the scenario, sorry, in the chat box, that's his first communication practice. For me, it's good. You have the good knowledge to practice as communication. Need only some organization, when to put this answer and when to say it and when to avoid it. That's it. And to make the conversation like question and answer, not always giving the answer. You are volunteer to give the most of the answers, even without asking from the surrogate side. So this is my advice. Just give him chance to react with you, to talk, then reply to him what you want to tell. But you have the knowledge, you have good knowledge about the HIV, how to do screening, what to do, instruction. The other thing as advice for taking history, don't ask, as Dr. Abdullah, you can't ask, do you have any history of blood transfusion? Do you have history of needle sharing? No, you can say it as instruction. Sometimes this virus can come after risk habit, like 1, 2, 3. What are the risk factor? You can say like sharing needles or any tattooing or piercing in the previous history or in the past. He will explore to you. Yes, doctor, I have done, for example, piercing or tattooing, so it might be the risk. But don't ask him, do you have history of transfusion? Do you have history of tattooing or blood transfusion? It will be considered like history taking. Okay, let's go to the point of disclosure to the wife. And you immediately told him, if you are having the virus, we have to breach the confidentiality. You don't know yet if he's HIV positive or not. So what to do? Just talk about his precautions and don't talk about the wife or the partner until you have confirmed the result. It will be considered like talking about or disclosing the news without confirmed test. And it will be against. What if you said that to his wife and the result came as negative? It might be some just diabetes and he has this candidiasis because of blood sugar or poorly controlled blood sugar. Or it might be also he's asthmatic patient using inhaler and this inhaler steroid, I mean, causing his candidiasis. So it will be far away from your diagnosis and you just disclose wrong information to his wife and put his life at risk, right? So the best way is to wait. We will do a test for your blood and to confirm this virus is present or no. And after that, if confirmed, I'm afraid to say you have to inform your wife or your partner. She will share with you the plan and she should be also traced for the virus because the fear of transmission to the baby in the future, we are taking care of you and your family and your partner. But to disclose without confirmation, this is, I guess it's not correct way. So this is for the disclosure and for the risk why he got the infection. Yeah, when you give him as breaking bad news, okay, you can say it as breaking bad news, but you didn't wait for his reaction. You start to explain without even giving him the time to react. You have you might have the HIV because of your defense system and blah blah blah. You have to stop. You give the warning shot, right? But after that, you have to give the golden silence. He will react to you. Oh my God! even I guess Dr. Abdullah couldn't say, oh my God, he's trying to say it, but still you are explaining. So the best way is to give him some time to react, then reassure him, we are here, don't worry, we are here with you. This journey will be with you. We will not leave you alone. We will follow up you, we'll give you the medication. Even with the medication, you might live near normal life, and be sure that we will do our best to be healthy as much as we can. However, the virus might get worse according to the compliance to the medication and so on. But give him some time to react. You have the knowledge, as I said, you have the knowledge and the way how to convince, but you are just talking without waiting for his question to answer it. So wait, every sentence will be a concern. He will ask you a question, it will be like concern. If you didn't give him the chance to ask, he will not ask and you will lose the marks for the concern. Okay? And as Dr. Abdullah said, in the beginning, you have to assure the patient this is confidential meeting. You suspect HIV, you have to say this is confidential meeting. You have suicidal attempt, you have to say this is confidential meeting. And you have any inherited condition like Huntington, you have to say this is confidential meeting. Okay, this is the three scenarios you have to assure the surrogate or the patient that this meeting is confidential. Me and you only will know about this meeting and details in this meeting. HIV as needle stick also one of the confidential. Any transmitted disease, sexual transmitted disease, also consider as confidential meeting. Okay, apart from this, as I said, you have the good knowledge to address any concern. Any question from Dr. Abdullah or Dr. Samah?
For
Just
me,
I have comment. The
Yes,
scenario is not obvious too much, but in the exam
exactly.
they mention they suspect that there is HIV, and you should counsel about the test. For
Mhm.
counseling about the test, I think she should mention that it will repeat it 3 times, and the result how it will deliver. It will
Mhm.
deliver directly like that, because the patient can, or the surrogate may not raise the issue that Dr. Abdullah said about I am fear to be or anyone know about my condition like that. So you should be the one raise this issue before, even the surrogate will not mention it.
Mhm.
So just we'll tell him that we will repeat the test to make sure, and we will deliver this result for you specifically by in the clinic without without any sending messages or phone calls or like that, and it will remain confidential, and you are the one will tell anyone from your contact or around to take the test, and if you need we can just call this partner without mention any which one we suspect him the contact, the risk of contact for him, to make him comfortable that he will not be the one anyone, even the close contact for him, they may not know about his condition also.
Yes. So yeah, I agree with this point. But I guess, Dr. Aisha, if we do the testing for HIV from the first time, we can do the PCR and ELISA antibodies. I will not do the antigen. You are talking about, I think, antigen, and then you repeat it again. But if you have the antibodies itself, so why I should repeat the test? This is not the first exposure. You got it?
No, it is usual for HIV because it is like a big issue. They repeated it 3 times. They're released. It's not released on the
Okay. Yeah,
system,
you mean
even
it's
not released on the
yes,
system,
yes.
and they will not do any PCR till the result will be confirmed 3 times.
Yes, I got
Yeah.
it. So even for antibodies, they are repeating to be sure, as like double check. Yeah, to confirm
Yes,
he is
recheck.
HIV.
Yes,
Yes, yes.
recheck for HIV. If
3,
they
yeah.
didn't release the result, you can't see it even
Uh-huh.
if
Until
positive
it will
or
be
negative.
confirmed.
Till repeated 3 times. Yes.
Okay, yes, yes. Okay, thank you, Dr. Aisha, for your comment. Any other comment from others? Any question from Dr. Samah? Dr. Abdullah?
No, Dr. Aisha, sorry, you said any test of HIV screening repeated 3 times antibodies?
Yes, this is the usual
Okay.
done. It will not released on the system till it repeated 3 times to be sure from the result.
Oh, okay.
Okay.
But
Also,
will be in the system that's also not confidential if it is like
I mean that is yeah, to make sure that the test is positive or to deliver the patient the test is positive. They repeated it 3 times before releasing it on the sample, on the same sample. Just it repeated 3 times.
okay.
for the
Thank you
point
for
of
your
consent,
exam. نعم.
yeah, please, yes, go ahead.
Exam wise بتقول if the patient said this not my result, this mistake like this, said for him I do double check.
Yes, exactly.
دي صراحة أول مرة أسمع بها، لكن ممكن يكون في اللايف through life ولا في near life. But in exam بيكون do double check for this to
Yes,
confirm.
supposed to be double check. Yes,
This
exactly.
my hospital policy, do double check for any result of any procedure.
Yes, of course. For the consent, Dr. Abdullah, you said it's written. I guess no more written consent. It's only verbal consent.
yeah. I maybe mistake. I said
Yeah,
written. Okay.
it's only verbal consent.
Yeah.
And if the patient refuse, yeah, better to convince him and address why he doesn't want, as you did, or as Dr. Samah did. Why you don't want to do the test? I am afraid it will be positive. No worry, better to catch it early rather than it will be late discovered and you might respond to the antibug and you might be near normal life. Okay.
Yeah, then sometimes also there's some issue of insurance, right?
Yeah.
Mm.
But it's not in this scenario.
Okay.
We don't know yet is the patient positive or still not confirmed. So it's like uncertainty. You don't know. Just candidiasis. Unless, as Dr. Aisha said, the scenario written clear, address the patient HIV situation, or
Mm.
talk about HIV possibility. So you have some background about the HIV. I guess in your scenario maybe defective, but yeah, it will be more clear about the task.
Okay.
Okay.
Okay. Yeah.
Thank you, Dr. Abdullah and Dr. Samah. Nice two scenarios, really, and a nice practice session today.
Dr. Vasa,
Yes, Dr. Zahar.
I
I'm
want
waiting for your comments.
I want
Yes.
to comment on this new guidelines about the HIV. If we will do the HIV ELISA test, if it is
Mm-hmm.
positive, it means that the patient is already has been infected
Exactly.
previously. So we will start the treatment on heart. But
Mm-hmm.
if the test is negative,
Mm-hmm.
then we will repeat this test after 3 months. And
Exactly.
if the patient has any exposure, we will start the post-exposure medicine for 28 days. And
Yes.
if it is for the first time, if this ELISA is positive, what we will do the confirmatory test, PCR qualitative and quantitative.
Mm-hmm.
Qualitative for the type of the HIV 1 and 2, and quantitative for the viral load.
Mm-hmm.
And after then, we will do the CD4 count for the opportunistic infections. This is the new guidelines.
Yeah.
And
Thank you.
about this, it is must to confirm my partner according to new guidelines. If you will have safe sex, it is not must to inform your partner, but we highly recommend you that you should
Yes.
inform your partner so that
Yes.
she can sit with you and make a plan for your further management.
Yes.
So I just want to add this comment.
Thank you so much. Thank you. It's precious comment as usual. So the antibodies, the quantitative, qualitative, and the CD4 count, all the things, as you said, it must be done whenever you have the ELISA positive. Or since the ELISA is negative, you suspect HIV, you can repeat the test after 3 months. And as you said, post-exposure prophylaxis must be started immediately if you suspect the patient or the stick from HIV patient or contact with HIV patient.
Within 72 hours or better
Yeah,
within
within
24.
72 hours, up to 28 days. Yes, you're right. And what else? Yes, for the partner, it's not a must as long as you are practicing safe sex. However, we recommend that you must, or you can inform her, she can sit with you to put a plan and also to take care of you and to be cautious about the precaution.
And in the long consultation scenario, examiner may ask if the HIV patient develop pneumocystic pneumonia, which
Mhm.
medication, which medicine you will give,
Yeah,
trimethoprim,
bacterial, yes. Yeah.
and if the patient develop this cryptococcal infection, fungal infection, then fluconazole we can give.
Hmm.
Then if the examiner can ask if the patient have cryptosporiodosis, which medication you give, uh, nitazoxanide.
Yeah.
So these may be the questions in the long consultation scenario.
Yes, you're right.
Examiner may ask. We should also know about these.
Yeah, we should know also about the CD4 count and the prophylactic antibiotics
Yes, yes, yes.
according to the count. The same as you said, BCB and Cryptococcus. So it depends on the CD4 count or discovering the organism
Yes.
according to the infection, which is okay. Thank you, Dr. Azhar, again and again for this precious informations. Any other comments? Any question? Any concern? So it's clear so far? Okay. If no more question, we can thank Dr. Abdullah and Dr. Samah, Dr. Aisha and Dr. Azhar, and all of you colleagues sharing today with me. We will meet together tomorrow, inshallah, with a long clinical case. I will end the session. Thank you, all of you. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much. Allah.
Thank you.